Right. So the question is whether clusters or tasks, is it increasing or not? Let's see some statistics. India has done well as far as the number of cataract surgeries is concerned. We may have done about a crore surgeries in the year ended on 31st of March 24-25. So as far as numbers are concerned, we are very happy. All right. But when we look at the causes of blindness, the epidemiological survey results, the 86 to 89 national survey, it showed that overall blindness had 5% contribution of surgical complications. Now, when the recent survey was concluded and published in 2019, the RAB survey, the overall blindness has gone down, but the contribution of surgical complications has gone up. It is about 7.2% of the total blindness. So that answers partially our question. If we look at our performance of the Adverse Events Committee over last 1.5 years, we have seen almost one episode, either a cluster or task, every month. We have seen 6 clusters and 12 task episodes were reported. 4 clusters were reported from Gujarat last year in 2024, which were not reported to the Adverse Events Committee. In fact, the number of unreported incidents are much more. We are afraid that only about 10% of these episodes get reported. If you look at the clusters, sharing of consumables was found to be the cause in 2 cases, and poor adherence to protocol was almost universally seen in all the clusters. Investigating these episodes poses major challenges because hospitals do not want to share information with us. They don't want to send samples for testing, and sterility testing requires good number of samples. Only then tests can be done. And pyrogen testing in labs is also taking a long time. So by the time the reports come, probably the whole batch of that particular material may have been used up. So these are some of the issues. If you look at the TAS episodes which were reported, 3 company IOLs were implicated, 2 company irrigating fluids were implicated, and viscoelastic, silicone oil, lubricating eye drops, bandage contact lenses, injection pilocarpine, and anti-VEGF drugs were also supposedly causative of TAS at some places. Friends, what happens after cluster getting reported is loss of name and fame for that doctor, and the hospital is naturally there. But in addition to all that, the OTs are ordered shut down by the government for prolonged periods of time. At places, ophthalmologists and or trustees were jailed, and licenses of some of the colleagues was suspended temporarily. The performance overall in the whole state drops for that particular period of time, and there are overwhelming amounts are sanctioned as reimbursement to the patient. Many times these decisions are ad hoc and baseless. We do not agree with all that, but we cannot help the situation, and even judiciary has taken similar decisions in some instances. So we believe that infections and TAS is a major challenge for the ophthalmologists, but we don't know what is the incidence because very little gets reported. We really don't know how to prevent them. There are a lot of guidelines available, but either guidelines do not reach us, or we do not agree with those guidelines, or we don't follow for whatever reason. And then quality versus quantity and quality versus cost are major issues in our country, particularly for the charitable activity where the surgeries are being performed free of cost. We could investigate a few cases of clusters, and I have personally done a lot of audits of several hospitals in the country. What we had seen was, in terms of the protocol, either people are not aware of the protocol, or actually the protocols were not even existent in that hospital. They did not follow any particular protocol. Whoever was working in the theater would do whatever he or she had understood. And if the protocols were there, if the guidelines had reached them, there was lack of agreement with the protocol, mainly for financial reasons in charitable activities. If you look at the infrastructure, Lack of enough number of instrument sets or equipments against the numbers that the hospital was performing was found to be a major issue, and improper layout of the theater was also seen in some of the cases. Lack of properly trained or qualified human resource was also found. Number of human resource available against the number of surgeries that the hospital was trying to perform was also an issue, and very poor documentation was also seen in some of the instances. We want to reduce the rate of endophthalmitis in the country and reach the western standards, which is 1 in 10,000, 0.01%, and even AIOS is targeting zero tolerance to infection by 2030. How are we going to reach there? We need to follow the guidelines, we need to maintain discipline inside the OT, and all of us need to become quality conscious. In India, chalta hai is our attitude, and that needs to go out the window, at least for the operation theatre activities. There are several guidelines available to help us. The AIOS guideline, which was published in 2018, NPCB has also published a guideline. Government guidelines are available. Dr. Nirmal sir will talk about it. There are manuals available to understand the science of infection control. There is a textbook available. There are infection control journals available. There is something like Hospital Infection Society of India, just like All India Ophthalmological Society. We can become members and get updated. I just want to remind you one very important thing. The poorest of the poor patient is at the highest risk because he is malnourished and has very poor hygiene. So if at all we want to follow stricter version of the protocol, it should be followed for this poor patient. In general, we see the reverse. We use the best protocol for our paying class of patients, and we compromise when we are working with poor patients. So I just want to remind everybody that that's not to be done. Reverse needs to be done. There is an adverse event committee formed by the AIOS. There are 28 members, all experts from across the country. We request all the members to report 2 or more cases of either TAS or endophthalmitis occurring at their place. The information shared with us will remain confidential. The link to the portal is given here, and we request everybody to report, so that once reported, the committee will come into action. And as I told you, we could investigate some of the cases. If we can get into more details, maybe our protocols will become better over a period of time. So I believe that helps you understand the fact that the TAS and infections are on the rise. Thank you so much.